Welcome to MedSynapse podcast series, where we bring you expert insights on key healthcare challenges and innovations. This episode 2 of our ongoing series with National Cancer Society of Malaysia as part of our ongoing effort to shed light on critical issues in cancer care. And today we're discussing an essential yet often overlooked aspect of cancer care, which is patient navigation. Navigating a cancer can be overwhelming, from diagnosis delays to financial barriers and fragmented care pathways. That's where patient navigation programs step in to bridge these gaps, ensuring smoother access to care and better patient outcomes. And to explore this further, we have with us Dr. Suwarna Ramanathan from NCSM, who is a dedicated medical doctor and public health professional committed to improving cancer patient support, health equity, and healthcare policy. Dr. Suwarna has worked in rural and regional Australia, gaining first-hand experience in addressing disparities in underserved communities, and now serves as a guided patient support coordinator at NCSM, helping to streamline cancer care pathways across Malaysia. So, Dr. Suwarna, it is an absolute pleasure to have you on the podcast today, and welcome to the show.
Thank you so much, Edwin. It is such a pleasure to be here.
So, Doctor, to begin with, cancer care can be complex and overwhelming journey, especially for patients facing obstacles like late diagnosis, financial struggles, and fragmented healthcare policies. So from your experience, what are the biggest challenges Malaysian cancer patients face in accessing timely diagnosis and treatment?
It's a very complex question in the sense that you've already provided quite a few key challenges that are presented to patients. For example, the fragmented healthcare system, the financial constraints. But from what I've noticed within the Malaysian diaspora is financial constraints would be one of the biggest challenges for cancer patients. I've organized a few focus group discussions with cancer patients in the past, and the one thing that struck me was one thing that they said was cancer is the disease of the rich. And I think that really paints a picture on how socioeconomic status and just generally financial health can play into cancer and I suppose cancer care as a whole. So then, if you look at it from a bigger point, I suppose in a bigger picture as well, when it comes to finances, you then look at where they're coming from. So socioeconomic background. We have a lot of patients from rural and regional centers in Malaysia. So that's also another big, challenge is when they get diagnosed with cancer, or it happens at a later stage because they don't have the access to healthcare as some of the patients in more urban, cities in Malaysia. So we've noticed that to be quite an issue. The other thing is also health literacy in Malaysia as a whole has some room for work. It could be better, and of course, as you would know, where there's less access to healthcare or health literacy in general, which is areas that are further away from the cities, it is definitely more difficult. And just to add on to two more things, the fragmental healthcare system that you spoke of before. In Malaysia, we've got a dual government healthcare versus private healthcare system, and we were, I suppose, when it was designed at that point in time, it was there to help relieve the burden of government, hospitals. But at this stage, it has come to a point where the system is so complex that if you were to go to a private hospital to seek some form of treatment, the transition to a government hospital at a later point can be quite difficult. And of course, private hospitals are not as accessible as government hospitals, just in terms of financial requirements. And finally, one of the more important and overlooked factor would be psychosocial barriers. So cancer carries a lot of stigma everywhere in the world, especially so in Malaysia, in the poorer communities, especially within rural communities as well. A lot of fear, stigma, emotional distress that leads to avoidance of diagnosis even. So the moment I've had many patients who would say, "Oh, I've got cancer, I'm going to die." So cancer is associated with death, which I think is sort of a universal stigma. So these are the sort of challenges that we face within our patient navigation program here in Malaysia as we try to navigate through these barriers. They are definitely a challenge.
Yeah, I think that's truly eye-opening, I would say.
So ma'am, this actually brings me to the next question. Is one of the biggest reasons patients delay or skip treatment is financial constraints. So many are unaware of financial aid programs or struggles to navigate insurance policies. So what financial aid or insurance support exists for cancer patients in Malaysia, and how effective has it been?
In terms of existing financial support, so of course, within the financial support itself, it usually comes from more government-led agencies or NGOs. And then with the insurance, I suppose, schemes, that's usually more related to private, I suppose, companies. Within Malaysia, for cancer patients, and how our navigators can come into play is that we help, when a patient is referred to us, we help assess their capabilities, or I suppose they're able to access these financial aid, because there are certain financial aids that are only available to people from certain, I suppose, financial standing. So then what our navigators do is that we have government assistance programs called My Salam, which is a government-led critical illness insurance scheme. And we also have a PKB40 health aid, but these are all targeted towards the 40% of Malaysian, population that falls within the lowest GDP, like gross domestic product per capita, and the eligibilities are already, mapped out for every individual in Malaysia. And all you need is your identity card number. And the government has information in terms of how well you're doing and where you fall into, the framework. And it's just to give a bit more of an explanation. So it's divided into, there's been recent changes, of course, but just largely B40, M40, T20. So the below 40% of GDP, middle 40%, and the top 20% GDP in the country. And of course, it's different for different states and different cities. But usually for people who fall within the B40 category, there is definitely financial aid available for them. But of course, I must emphasize it is not much, because cancer care can be very expensive, all the way from your medications to transport to just general holistic care. What about diet consults, psychosocial consults? So while we have the government assistance programs, we also have NGO-led financial aid. In NCSM, we focus on sustainability, and we would like to offer services instead. So we have in-house dietitians, psychosocial, mental health professionals. So essentially clinical psychologists and counselors. And we also have a peer support coordinator. So they are in charge of all the peer support groups. Mm-hmm. So this is where patients who require these sort of services can always get in touch with us. We also provide services such as means testing, where we, test the means of a patient to afford a certain drug. If, we go through their financials, and if they qualify, they get some extra support from the specific pharma company that we are working with. There's also more religious, entities that you could ask for financial aid from. So if you've heard of the term zakat, which is something a lot of Muslims pay as part of their requirements every year to the government, and actually to the state governments. So Muslims specifically can apply for financial aid from these entities, but they've also got a pool of money that's available for non-Muslims who, who require some help. So there's always aid, but I must emphasize it's not much, but it's something. In terms of insurance navigation, so as you would know, navigating through insurance claims and all that can be quite difficult, just generally for anyone. So this is where our navigators would come in. We've already trained them with just general insurance, schemes, how they work. And what navigators would do is then advise patients on what sort of what's the next step to do. And of course, navigators don't have the, ability or the consent to do the claims itself for the patient, but they can always nudge the patient in the right way. Or did you know that you could claim this under your insurance? Did you know you could go to this hospital perhaps that offers you a better insurance package deal? So they're there. They're definitely there to help for people who require it. But of course, just taking into account of how expensive cancer care can be, there could be more. There's always more as usual, but more.
Yeah, I think that's encouraging to hear. But as you also mentioned, that navigating these financial systems are also very overwhelming, I would say. So yes, there's always space for room for some improvement also. And it's just reassuring that the patients are not alone in this financial maze also. So there's so much help they're getting. So that's really reassuring to hear.
So now, doctor, the next question is, cancer care is never a one doctor journey. Patients interact with various oncologists, radiologists, surgeons, primary care doctors, and many more specialists. So with so many healthcare providers involved, how do patient navigation programs improve coordination and ensure patients receive timely, seamless care?
Yes, so this is where I think patient navigators are so important, because they act as a single point of contact. So usually what happens is we have our patient navigators in hospitals, and doctors are aware of their presence and their service. So what happens is, once the patient sees doctor, said doctor will then refer to our patient navigators, who will then take on the case, speak to the patient, establish contact, and essentially map out their barriers. So we look at their, emotional barriers, financial barriers, or whatever constraint that you may think of. And sometimes it's logistical barriers. So this is where they can come in handy, where they can also help a patient sort of plan the logistics around cancer care. So for example, if oncologist A says, okay, you need to get this done, and on this dates. So patient takes that information, comes to our navigator, and our navigator can help then, help the patient organize their day. But having said that, how this connects to the primary doctors and radiologists is that our navigators are then trained to nudge patients to keep track of their appointments. So if, say, a patient's treatment plan from their primary doctor, primary oncologist, comes up as, oh, you need to see a radiologist, you need to, there's this referral, you need to date, navigator then makes sure that the patient adheres to said date. And if they can't, they will try to find ways to work around it. Some of them have direct contact with the doctors itself, so they can then help arrange for different appointment time. And there's always continuity of care, because this navigator will be placed in the same clinic for weeks on end, and a day a week. And usually when the patient comes in, it's the same face. So they know the navigators, they're familiar with the navigators, and our navigators will liaise with the doctors as well. But of course, under no circumstances are navigators allowed to give any medical advice. They're just there to help navigate through the system, because half of our navigators are cancer survivors themselves, or retirees who want to give back to the community. So this is where they come in very handy as a single point of contact. That's usually how the coordination works. Other things that we've done is we've introduced a few digital health tools for our navigators, so that we can also keep track of the patient progress. So this is where they input, patient information through our medical records, all compliant with privacy, laws. And that's where referrals are also made to NCSM for our dietitians and our clinical psychologists, counselors. And that's also one way of us keeping track to see where the patient is at in their treatment journey. So these are two things that I can think of at the moment.
Yeah, I think that makes perfect sense also. And actually, that brings me to the next question. As you also mentioned earlier, that patient navigators don't just handle logistics, they also provide emotional and psychological support to patients. So, how are patient navigators in Malaysia trained to support beyond scheduling and referrals?
Absolutely, absolutely. So if you can think about our patient navigators, they're your one-stop center for everything that you may require. And so as I said before, logistical help, they can help you, I suppose, navigate through the financial systems in Malaysia. But most importantly, they also act as peer support. And as I said previously, half of our navigators are cancer survivors themselves. So there is that shared, I suppose, value, shared emotions as a cancer survivor. But the very important thing that we'd like to emphasize is that our navigators go through a very rigorous 6-weekend training where we train them on, so there are formal training modules covering cancer care, psychosocial support, and communication skills, because of course we're getting a very wide variety of I suppose navigators who sign up. And just to emphasize, they're mainly cancer survivors or retirees. They're not necessarily from a healthcare background, so they're not trained to I suppose be able to work through the emotions that come with when you are a healthcare worker, because you're exposed to death, you're exposed to building good relationships, but then to see the person suffer, deteriorate, and eventually pass on. So you need to be able to learn these regulation skills, and that's something that we emphasize through our training. There are a few modules where we get our clinical psychologists to come on to explain a little bit more on, firstly, self-care, boundaries. Secondly, boundaries are very important as a patient navigator in order to be sustainable in your work, and I suppose for any healthcare professional as well. There's also cultural competency and sensitivity training. As you would know, Malaysia is a multiracial country, so we've got the Malays, Indians, Chinese at large, and of course we've got the indigenous population as well. So when our navigators go out there and they meet patients, they need to be culturally aware. Some cultures have a different way of dealing with cancer as compared to the other. There are regular peer support and mentorship programs as well. So within NCSM, we try to run a monthly debrief with our navigators. So if they've had a difficult case or any issues within the hospital, they can always voice out to us. And in case they require mental health support as well, or they can always come to us. And we always check in with our navigators as well to see how they're doing, because if things get a little bit difficult for them, we would like to protect them as well so that they are able to sustain doing the work that they want to do.
Yeah, that's such a holistic approach, I feel. And I think it's just not about medical care, but also mental health is so really important. Like emotional support is needed at this time. So like Dr. certain cancers like lung or cervical cancer can carry a huge stigma, leading patients to delay seeking medical help. So how do patient navigators tackle this stigma and encourage patients to seek timely care?
Things like stigma, stigma in general is very complex, and it's multi-layered, as you would know. It's not as easy as just, having a chat with the patient, because it requires us to have a look into their upbringing, their cultural awareness, and I suppose influences, growing up. So our navigators would come in from a more peer support perspective. And of course, they've been trained on all the cancer myths and cancer busting, I suppose, information. So if a patient were to present with a specific myth, our navigators are well trained to be able to address them. For example, I should not eat sugar because it is going to help cancer grow. So these are common things that our navigators would be taught during training on how to I suppose, explain. But most importantly, when there are things as such, when there's stigma as such relating to a specific thing, for example, food, this would prompt a dietitian referral. So they will try to myth bust, number one. Number two, they will get referred to a dietitian so that this advice comes from a professional. And I think that's a very important step in dealing with stigma. You should have professionals to come in and explain, but also a professional who's culturally I suppose, aware and sensitive as well. The other thing that we do, well, not just the patient navigators, but NCSM as a whole, is that we do a lot of community engagement and education. This is where patient navigators also come and join whenever they can. So this is when we go out to more rural communities and I suppose increase awareness through our health promotion campaigns. We also have peer support networks as well. And we found that has been quite helpful with alleviating stigma, especially when people can come together. We've got a lung cancer support group, we have caregivers support group, and we have a young adult cancer support groups. And of course, we've got the children. I suppose that is more of a cancer alliance that we've got, the National Childhood Cancer Alliance. We've also got breast cancer, very active, or more specifically, actually, women with cancer. They're called Pink Unity, and they're very close with NCSM, very, very, very active group. And we've also got a prostate cancer Malaysia. They work very closely with us. But we also work in tandem with other peer support groups such as Forum, which is the colorectal cancer support group. And I've noticed that whenever patients come to us and they have these, issues or stigma, we refer to a peer support. And the best part is to watch the patient then become part of the support group and come back to help other newly diagnosed patients. So that's always a nice.
So interesting, yeah.
Yeah, I think that's such an important conversation to have with the patient, and I think changing perceptions and creating a supportive environment at that time is key. I think it's really important. So now, doctor, without wasting much of your time, my final question would be: many countries have well-established patient navigation programs. So, what lessons have Malaysia learned from global models, and how can they be tailored to fit local healthcare needs?
Absolutely. So. We are indebted to the American Cancer Society for supporting our patient navigation program in Malaysia. So a lot of the things that we do, we take a lot of the good stuff from what they've done over there. And as you would know, the US has pioneered the patient navigation program through Dr. Harold Freeman, who established the first model for underserved cancer patients. And what I really like about what they do is that they integrate social workers, and I suppose health workers into their patient navigation program. And it is quite, I would say, sort of the word's legit, but it's more so that it's more professional. It's a job. And there are career pathways within patient navigation, which really then encourages people to continue the work, the real good work. Because currently one of the issues that we face is that it's fully volunteer run and volunteer based. And of course we remunerate our volunteers through, stipends, honorary remunerations. But of course it's not much. It's not a salary. It's not a job. But what I like about the US is that they've turned this into a full-time job because they have recognized how important it is to have patient navigators within a very complex healthcare system. So I think that's something that we can do here in Malaysia, but it will take time, and it will take time. I don't know we're there yet, but it's definitely something that we would like to aim towards. The other thing that I've noticed that Australia does this really well, because I worked there for quite some time, and they have a large emphasis on Indigenous healthcare, and especially cultural sensitivity. So, for example, when you speak to them, the sort of prejudicial terms that may have been used by some medical professionals unknowingly, it could be very normal to anyone else, but may come off as racist to an Indigenous person or something along those lines. But I think what they do there is really good and important, and it's something that we can perhaps tailor to Malaysia, because we have different cultural backgrounds, religious backgrounds, but Malaysians are largely aware of everyone's, which is good in a way, because everyone's largely aware and very cooperative and I suppose collaborative. It's currently Ramadan, so it's the fasting month. Everyone goes out and to break fast with their friends at at sunset. So that's always nice. This is something that we do. So if we can have that as part of training, I think that would be really good, just across the board. I think these are I suppose tailoring these global, I suppose, programs would then require to see how Malaysia can work into it. Of course, we've got our constraints, we've got our, I suppose, issues to first deal with. So I think taking up these two big lessons would be good to incorporate within our system. But of course, we have issues such as even, screenings, basic healthcare, health literacy to first tackle. So I think, once we get that on board, once we get on board with that, there's more health literacy, there's earlier screening, there's earlier diagnosis. We can definitely see more navigators coming into play, and we can definitely see the effects of it in the long run as we hopefully reduce the burden of disease on the Malaysian healthcare system.
I think, yes, it's so great to see how Malaysia is actually integrating international models while also, ensuring they work for their unique healthcare system. So it's really interesting to know. So, Doctor, as we wrap up today's session, let me tell you that this has been incredibly insightful conversations. Thank you so much for sharing your expertise and insights with us today.
Thank you so much for your time, Hetvi. I've had a very good time going through it myself, and just to see you, I suppose, reflect through the process. So this has been very good for me too. Thank you.
Yes, truly. And it was so inspiring to see how actually patient navigation is transforming cancer care in Malaysia. So thank you so much for sharing that with us.
Thank you.
And to our listeners, if you found this discussion valuable, please like, share and subscribe to MedSynapse to stay updated on further episodes. And let's continue working together to make cancer care more accessible, coordinated and patient-centered. So until next time, take care and stay healthy.